I really like the quote. It's from Tom Robbins that equality is not treating different things similarly, it's treating different things differently. And kids who have ADHD do have a neurological condition that makes them different. And so trying to or expecting them to be able to function optimally in a world that is not set up for them neurologically is not going to be the best option for them. And so, in looking for the best option for a kid, really understanding their mind and how it's working and what they need in order, again, to show up as their best selves is the best that we can do.
Yeah, great. Okay, welcome everybody. I'm Tony.
And I'm Casey.
And welcome to Anthony's Way, The Road to Kindness. And you're listening to our podcast and YouTube channel, The Way Forward, A Kindness Mission. And before we kick off this episode, we have a wonderful sponsor called Vicinity PLLC. And they are in Raleigh, throughout Raleigh. They have 3 offices. And they're a wonderful sponsor, wonderful pediatric group, pediatrician group. And we thank them because they sponsored us for the whole month for June, which is Children's Awareness Month. And they've been great to work with, and we really value their partnership. So, today's episode is really unique in the fact that we've gotten so many questions on this topic. And the topic is, I think my child might have ADHD. And parents come to us to reach out, and they may reach out directly to us or through our various social media sites, and they really don't know what to do. All right. So, and they feel bad because they may not be addressing an issue, or someone else. And a lot of times the pediatrician is really the first person that they may talk to in this cycle. So, so we brought some really wonderful people to chat with today, and experts that we want you to hear from, kind of weed through all of the issues, the challenges, and really, create a roadmap for parents to follow. So I want to welcome Lauren Francis, and I want to welcome Meghan Shapiro joining us today. And we're excited to have you both with us. And I'm just going to give a brief blurb before we get into, before you can expand on your backgrounds for us. Lauren is a licensed psychological associate in North Carolina. And again, both Lauren and Meghan are both in North Carolina, and they have to work within the bounds of North Carolina. But you'll find people just like them in other states. So, and she's a clinical director at Chrysalis, the Chrysalis Center here in Wilmington. And she is also part of Anthony's Way, The Road to Kindness, our advisory board. So welcome to you, Lauren. Nice to have you with us today.
Thank you.
And a good friend of hers, she brought with her Meghan, who has a master's in clinical psychology and is also a licensed psychological associate in North Carolina. And Meghan is the founder of A Different Path Mental Health PLLC in Wilmington. Meghan has over 20 years experience of focused psychological assessment and in helping determine whether a child or teenager has ADHD and other co-occurring conditions that go along with it. And both Lauren and Meghan work closely with parents and provide support as needed. And we're so happy to have you with us today and to help us answer these questions that our parents have out there. So, why don't we kick it off? And Lauren, why don't you start give a little bit more on your background and the things that you do, and then we'll go to Meghan.
Absolutely. Yes. So as you mentioned, I'm a licensed psychological associate. So I also have my master's degree in clinical psychology from App State. And my work primarily focuses on helping kids and teens and adults navigate mental health concerns, including ADHD. I really enjoy working with kids and teens because I think early intervention is so important. And obviously helping their parents to understand how to best support them. And then also, again, working with the other challenges and other mental health concerns that come along with that.
Yeah, it's great. Thank you. And Meghan, why don't you give a little bit more on your background?
So I've been, like you said, working for about 20 years. My work has always focused in some way on children, whether it's been providing direct services to children, more recently doing more assessment, less direct services. Well, assessment is a direct service, but not direct therapy with children. But assessing children and then working with families to try to figure out the next steps forward after their child has been diagnosed, be it with ADHD or another psychological condition, and just figuring out how to help the child show up as their best self.
That's great. Okay. Yeah. Well, I'll tell you what, the main question that we get from parents is, how do I know? What are some of the indicators, if you will, that my child might have ADHD? And then who do I turn to? What do I do? So, Meghan, you want to kick that off for us a little bit and give some of the items that you believe and that are indicators so parents can get a little bit of guidance here?
Absolutely. So I always start with parents by saying that kids don't want to do poorly. They don't want to get in trouble. They don't want to be failing at school. So when you start to see that going on with a kid, you've got to ask yourself what's going on with them. And so I think that once you start hearing yourself asking that question, you have some indication that there's something going on with your child. ADHD particularly can look like a lot of different things. Sometimes it's just, well, I say just, but sometimes it's problems with focus and attention. And so a child isn't hearing instructions at school and isn't knowing what to do. So then they get their work and they don't know what to do with it. So you see them falling off there. Sometimes it's difficulty with impulse control. So they're getting in trouble because they're not paying attention. And then they're doing something disruptive in class because they've gotten excited by something. So basically, I would say that what you want to look for, though, is your child failing to do what they want to do in the way that they want to do it? So are they getting in trouble at school? Are they not completing their work? Are they having a hard time with their peers? Are they having a hard time with parents? And I think that gives you an indication that something's going on. And then I think the next step would be to go to a professional and have them help you figure out exactly what is going on, because it's hard to tell. There's so much overlap in symptoms, what it is, before you've had some assessment and had somebody really look at the constellation of things.
Yeah. So is there a difference between boys and girls? Because we get asked that a lot too. Like we hear a lot that girls, it sometimes takes a little longer to really identify if a young girl might have ADHD. Is that true?
Yes, to some degree. So what the research finds is that when a child has ADHD, girls and boys can look a little bit different as far as co-occurring behaviors or conditions are concerned. So whereas boys tend to exhibit more what we call externalizing symptoms, which are things that you see externally, so behavior problems or defiance, girls tend to exhibit a little bit more internalizing problems where they're turning in on themselves. They'll endorse more symptoms of anxiety, more physiological anxiety, so they're feeling it more in their body. And that's really where you see the big difference. There are different types of ADHD that both girls and boys can have. It's more those co-occurring things that are different.
Go ahead.
So for a parent who thinks that they may have a child with ADHD, what is their first step besides questioning themselves?
I would say thinking about the resources that they have. So if the child has a pediatrician and hasn't really been involved in mental health care previously, maybe reaching out to the child's pediatrician if they think they might be interested in some assessment, but also talking to teachers at school and seeing, are you seeing some problems at school as well, and really starting to gather information that might provide some direction as far as where to go next, whether it's talking to the child or taking them to see a mental health professional.
And how do you feel about internet assessments?
Well, internet assessments are generally free, except for, of course, your attention, which means that there hasn't been a whole lot of resources that have gone into the development of them. And the more resources that have gone into the development of an assessment, the better the assessment is going to be. So as far as scaling where you're going to get information, a free internet assessment might tell you something, but it's probably not going to give you information that's valid or very useful. Using assessments that have been validated by being normed throughout the population, so that one kid's scores are compared to the scores of the whole not the whole population, but a representative population of kids, gives you a little bit more specific and probably more valid information about what's going on with them.
And what does a full ADHD evaluation, what does that look like? And how do you make it child friendly?
Yeah.
So we always start with a good clinical interview, which means that the child does come in for that with their parent, and we ask a lot of questions. What are you seeing at home? What are you seeing at school? Want to get a good history of what's going on and just get a really good idea of what's going on with this child, any sort of illnesses that they might have had or any co-occurring things. We just want to really know what's going on. From there, we make a plan for assessment. The plan for assessment can include questionnaires that the parents and teachers might fill out. If the child's old enough, they themselves might respond to some of those questionnaires. And if we think that it would be important or valuable, we sometimes have the child come in and do some cognitive testing too. So maybe an IQ test, and there are some other neurological tests that we can look at to really assess memory functioning and what's going on with that child. But we try to make a plan that's tailored specifically to the child and what it seems like the child will tolerate. We don't want to give the kid an experience with a mental health professional that prevents them from wanting to seek services or help in the future.
So is that assessment when you can determine, like, number one, if they have ADHD or if they have learning disabilities or if they have like anxiety issues? Is that a time when a lot of those things can be found out?
Yes. And in different assessments, we'll tell you different things. Like I said, we might add on, if we suspect that there might be a learning disorder, we would add on additional assessments and really just try to tailor it specifically to the child and what it looks like is going on with them.
So for our parents, what are some of the questions that you might ask them, and what are some of the questions you might ask the child? And how do you, as you mentioned, how do you make it so that the child doesn't feel apprehensive to sitting down and doing this? Because I'm sure, when Anthony, well, you're going to come along, you're going to go get your assessment, I mean, and yeah, he followed along, but I'm not sure how engaging he was through the process. So how do you get them to really engage with you, that they really want to share what they're feeling and what they're doing?
That's a really good question. I always try to talk to the children about our goal here is to really help you. So we've acknowledged that you're having some problems with things and that you don't want to be having those problems. So I really try to establish that we don't think that you are bad or that you're being defiant or that you don't care. We really just try to say, we understand that these problems exist. We want to understand why this is happening and see if we can do the best that we can to solve the problem for you and make things a little bit easier. And I've really found that when kids hear that and when we clarify that we're not trying to figure out if they're a good kid or a bad kid, that they do tend to relax and open up more. As far as questions that we ask questions about how are things, so we ask what's going well. I always like to hear about what's going well for kids.
Great.
I think that helps the kid too. We start with that and have the parent talk about, what are their strengths and what are they really doing well. And then we talk about, like, what are the struggles that they're having? What are you seeing at school? What are teachers reporting to you? What are you seeing at home? I ask about, is there a lot of arguments about messy rooms, or are they forgetting things? Like, are they getting to school and realizing they don't have their backpack? That kind of thing that would just indicate some problems with attention and focus.
That goes for adults too, because there's many days I used to walk out with my computer and have to turn around and go back and get my computer. So yeah.
So when the results come in, do you sit down with the parents and the child, or just the parents at first and then maybe bring the child in? Like, do you do it all together for the result piece of it?
I do whatever the parents think is best for their child. I really operate under the belief that nobody knows a child better than their parents do. Mm-hmm. So I don't try to really drive that. If parents ask for suggestions, I'll provide it. But I always say to the parent, what do you think would be best? Do you think they're going to tolerate this? Do you think it's going to be too much for them? And just try to make it very specific to that child.
Do you feel like by the time they come for an assessment, how is their self-esteem maybe starting to suffer a little bit?
Yes. And I would say, it's just as far as when we were talking about in the beginning, how do you know if your child has ADHD? And that is what you start to see. You start to see frustration from them because they know they can do better and they're not able to. Or they know that they want to not be getting in trouble every day at school, and yet they are and they can't help it. And that's one of the reasons it's so important to intervene.
So let's just back up for a second. So you have the parents and the child, right? Who else is involved in this process? Who else do you get questioned? Do you send information out or get information from during this exercise? Who else is tied in?
So definitely send questionnaires to the school. And then I let the family tell me, like, who is an important part of your community. I've talked to occupational therapists and speech therapists, other family members. Like, I've had older brothers come in if they were involved, if they're significantly older and involved in the child's care. It really is just dependent on the child, but it's important to get information from the whole community because children have different relationships with different people, and so different things will show up.
So from the school perspective, is it the teacher and the school psychologist who you might get involved, or
generally the teacher? I say, and it can be multiple teachers, but I say to the parent, whoever you think has the best idea of what's going on with your child at school. And usually by the point they come to me, a parent has already gotten some feedback and had some conversations with teachers, so they know who knows what's going on at school.
Yeah,
it's true. We knew.
Yeah, we knew.
We had a good idea for Anthony. So then sitting them down, and from that point, where does it go from there? So you do the assessment, you identify, yes, they have ADHD, and what do you do if you find somebody who might have borderline? You're not sure. Are these tests unequivocally that they tell you, yes, you have ADHD, you don't have ADHD, or what? No, okay.
There is definitely clinical judgment that comes in.
Okay.
And so as psychologists, one of our missions is to help our clients no matter what. So if I'm really not sure and I've gotten all of the information that I can get, I ask myself, what is going to be in the best interest of this child? If it's very clear that they are having struggles and that they need intervention, and I can't say 100% this child has ADHD, I think I would err on the side of diagnosing in order to be able to get them services that they need. But I would indicate that in my report. So the report is a pretty lengthy document. Mine are typically 14 to 16 pages, and it includes all the information. So that would be something that I would talk to the parents about. Say, I think that we're looking at ADHD. Let's try some intervention for ADHD. And if you're not noticing improvement, then come back and let's see what else we can figure out.
Okay. So get this document, you give it to, who do you share that document with? Just the parents and the child, or do you share it with the school too?
I share it with the parents, definitely. And then whoever else the parents ask me to share it with. A lot of times it gets sent to a pediatrician's office and to the school. And sometimes the child's in therapy as well. And so I'll send it to their individual therapist.
Okay. So for Lauren, then we heard.
Your turn, Lauren.
We heard the word co-occurring conditions. Can you tell people what that is and what, because we hear comorbidities out there, but I like the word co-occurring because it's a little softer. It means that they might have some other things going on. Why don't you share what might some of those be, and how would you help in some of those cases?
So there could be a lot of different things. I will say, like, this is probably, it's most common that I start seeing a kid or teen for something else and then maybe start to notice some signs of ADHD being a concern. So that could be things like anxiety, depression, like interpersonal concerns, self-esteem issues, all kinds of things could be the presenting problem. And, in my philosophy of treatment, I really always want to find the underlying issue, because that's how we create sustainable change and sustainable improvement. And I mean, that's with everything. So if a kid is coming in with self-esteem concerns or interpersonal concerns or school-related concerns, and I notice that there may be some signs of ADHD, then that's what we really want to target.
Yeah, because if you get the main issue, then you can really help them the most, right?
Right. And that's not to say we're not working on those other things.
Right.
We are doing that as well. But kind of understanding how it all works together.
So it could be within a given child that, Lauren, you may see the child first and think that they have ADHD and suggest that they get some type of assessment done, right? Mm-hmm. And then Absolutely. It can work the other way too with Meghan, is it can start with you, and then you could say, well, I think maybe they need some therapy, and then go to Lauren. So it kind of works both ways, right?
Mm-hmm.
There's not one specific way it has to happen.
Definitely not.
No.
Yeah.
So, I did hear you say occupational therapist. Did I hear that right? Did you say that? What does an occupational therapist do versus what, Lauren, like you might do, or how does that all fit in? I mean, because we've started hearing more, and parents starting to tell us that, and Anthony, we never heard of that before.
No.
So how, from a child perspective, how does an occupational therapist, what do they do?
So the first thing I'll say is I think having an interdisciplinary team is really best practice. So my role as a mental health therapist is really to focus on providing emotional support and coping skills to manage either the ADHD, like maybe some behavioral interventions to help with focus and concentration, and just learning how to navigate life and school and all kinds of things with neurodivergence, and then as well as providing support and talking about the other things that come with having ADHD, and that's on an individual basis. Meghan, I think you may be able to explain what an occupational therapist does better than I can.
So from my understanding, an occupational therapist will help a child who has ADHD with any sort of sensory processing problems that they might have. So really working through that, working on grounding when they're feeling like they're becoming disorganized because of sensory things going on.
So sensory being like tics, would that be sensory, or is that not sensory?
No, so there's a pretty big overlap with children who have ADHD and sensory processing problems. And so our brain is constantly filtering out sensory things that are going on, like sounds that are happening in another room, the way that our clothes feel on our body, smells, any textures, any of that kind of thing. For some children, and this is particularly prevalent with children with ADHD, their brain doesn't do such a good job of censoring that out. And so they're having just much more of a sensory experience than a lot of other people might be. And so an occupational therapist can help the child be able to navigate that.
Okay. So let's go back to Lauren. From if a child comes, or a parent, that you do both of them together, like is there an age where you'll be working with both of them and then they spin off, or do you try to do both children and parent from a therapy perspective?
So depending on the age, I think the involvement may be more with younger kids, but I think I would always want to involve the parent to some extent. I think primarily the reason for this is I can teach a child coping skills and talk with them about what they're experiencing, but I only have a limited amount of time with them. And so I want them to be getting that kind of support and validation at home as well. And so I would want to teach the parents more about ADHD and the other concerns they're experiencing so that they can help implement the skills that we're learning at home.
Is there one type of therapeutic support that you maybe is better than some of the other ones?
I think
it
depends. There's no one size fits all. So individual differences are very important in therapy, and sometimes we have to try a few different things before something sticks. I would say my go-to as a psychologist is probably cognitive behavioral therapy. Um, because I think that kind of covers a lot of areas. So it teaches about the behavior modification, and things that can help support them in school and at home with chores and homework and things like that. But also it digs into kind of the cognitions that may be contributing to some of that low self-esteem. So we can approach that as well.
So you get a wonderful baseline by the assessment, right? That's kind of your baseline, which then draws into all the other, if there's co-occurring conditions, then, see how you can help them through, whether it's therapy or whether, even sounds like parent coaching too, where you're giving the parents, telling them, hey, these are the ways you might want to think about behavior, issues at home, and we've heard other from other people and other coaches say, it's the early morning time that's a big challenge. It's the homework time, right? And then it's when they go to bed. Those are the three that we find. So, so giving them tools to help their child, especially if they're having issues at any challenges at any of those, that would be the therapy side of the equation, right?
Mm-hmm. Yeah. And I just validating their experience and also connecting them with support and resources if that is needed, because it can be challenging. And it can feel isolating, and we want parents to have support too.
What other types of support do you offer besides just what you've told us?
So at Chrysalis, we have medication management available, and we also have nutrition services, which can play a role in helping someone with ADHD. But personally, as myself, I am primarily just doing individual therapy, and then again, including the family, and also communicating with others as needed to advocate for the child and the family. Like if I needed to maybe speak with a teacher or the school to help them gain some understanding, that would be a possibility. And also kind of continued collaboration with other providers involved on the treatment team. So maybe the occupational therapist or the medical provider.
So you hit on an important point here. So they get the assessment, they could see you, Lauren, and so getting the school involved. Who creates this? We've heard, 504s. Anthony had a 504. Who helps to create the 504, the IEP? Is that the you folks help, or the school psychologist? Who's the main people that the parents need to work with, or do they give them ideas on what? Because you're giving them what they need, right, Meghan, from the assessment side. You're telling them, hey, this child may need additional time to take a test, or whatever it might be. So then that all rolls in. Who writes this 504 IEP, or what, and just help people understand what might be the difference? That makes sense?
Yeah. So I would say, yes, Meghan would be providing a lot of the recommendations of what might be helpful in the assessment process. And from my understanding, Meghan, you're writing recommendations for things like that, but also like for me, like what might be helpful to work on in therapy, which is the great thing about having the psychologist do the assessment.
Right.
But we, as a therapist or as psychologists in a clinical setting, are not able to actually write the plan. So we would then hand that off to the school psychologist or the representative from the school to complete that.
Okay.
What do you say to parents, and I'm assuming this is happening, but the parents that feel really bad or may feel guilty because they've missed some things, or maybe they've waited too long and their child is really struggling. What do you tell parents to kind of alleviate some of that, or do you want to alleviate that?
Yes, definitely. I think it's important, like, we don't know what we don't know. So if you don't have the information I wouldn't even call it missing something. Like the fact that they're bringing their child now and getting the help is what really matters. And they clearly are wanting to learn more and asking questions. And that's way more important than the fact that it wasn't done at a specific time.
So focus on going forward.
Yeah.
Absolutely.
That's great.
Yeah. So can both of you share some success stories with the listeners? Like, share a success story. You identify some issues and challenges, and how do you really turn those around, or how do you guide? What are some success stories? Because we hear from parents, we get calls, and we hear a lot of negative things. Like, they got the assessment, they have ADHD, but then now, okay, things aren't working out. There's behavioral issues, there's other challenges, but we really think that this can be a really strong, ADHD can be, a superpower for the kids, because they're creative, because they love things, they love sports, or once we find their passion. So, share something that's, really been helpful and positive that you've seen.
Do you want to go first, Megan?
Sure. I think that the thing that really jumps out to me is that once you have identified and can start addressing ADHD, often ADHD has served as an accelerant for other coexisting conditions. And so a person or a child may have been trying to address anxiety or depression for quite some time and really done all the things. You've gone to therapy, done their homework, done everything that was recommended, and still not experienced a whole lot of relief and symptoms. And so once you diagnose ADHD and start to address ADHD, a person really starts to notice that those other coexisting things start to get better as well, because we've addressed ADHD. And that's one of the big things that I notice is just kids who are just down. They've been, they've tried to address depression. They've been in therapy. They come in and say, I've been seeing a therapist and it's just not working. And they really start to feel like maybe there's something wrong with them. And so once you identify ADHD, you implement whatever sort of interventions the family and the child and their providers agree upon. A child really starts to feel better all around. And we've talked a lot about how the ADHD impacts school and at home. ADHD also has an impact on a child's functioning with their friends. So a lot of times they've had experiences with friends that have been negative, or they don't have as many friends as they wish that they did. And so also once you start to address ADHD, and maybe they're a little bit less impulsive, maybe a little bit less annoying, they start to have a little bit more positive experience with peers. And I mean, we know that that's huge for kids. And so when we're talking about success, those are really the things that I think about is how are the ways that a kid's life's enhanced when you start intervening.
That's great. Lauren, do you have any other successes?
So the first thing that comes to mind in terms of success story is I have a very close friend who has a child with ADHD, and I think they had a lot of hesitation about getting support through the school specifically, just because of fears of labeling, and the child was having a lot of issues with getting in trouble in class and maybe acting out. And as soon as I think the child, and the teachers realized what was going on, a big change happened. And that's not to say there are not still mistakes or, things that can go wrong, but I think, feels a lot more understood, and his teachers have a better understanding and are able to kind of intervene in a more effective way rather than solely with punishment or
right.
Yeah.
Do either one of you feel that parents should they should back off from wanting to label their kids? But their child basically is already getting labeled, right? I mean, in school, if there's some behavior issues and things like that. But what do you tell a parent who's like, I don't want to tell the school this is going on, we're just going to go with it or whatever, because I don't want them to be labeled?
I would say I try to think of a diagnosis less as a label and more as like a map of how to move forward. So we want not to put the child in a box, but to help everyone around them understand how to best support them and how they can, again, operate and, move forward in their lives to be successful.
The reason that comes up is because we've had parents tell us that they really haven't even told their child what the diagnosis is.
Mm-hmm.
And, I think we all agree that that's something that they should talk to their child, right, with you, with the help of you two or folks like you to share, and talk about the positive things too that can come from having ADHD, and the good stuff. I mean, because every child has a good within them. They just might be acting out. They might be, depressed, or they might feel isolated, or or they don't have friends. But a little bit of maneuvering and help training them can make a big difference, right?
Yes.
So, I mean, and it helped Anthony. We had a psychiatrist for Anthony, and he helped him a lot.
We were one of the lucky ones.
Helped us a lot too, because we needed their special care. We needed special things. Anthony did have tics and and other things, and we had to figure out how to deal with those. And so
when does the medication
let's talk about that
conversation come in?
Great.
Either one or both.
Medication for ADHD.
So medication is part of it can be part of the treatment. It doesn't have to be. It can be part of the treatment. Neither Lauren nor I are qualified to prescribe medication or provide recommendations to parents about medication.
Okay.
So we would refer the child either to their pediatrician or their primary care provider, or to a psychiatrist if that was something that they were interested in. A lot of times parents do have some hesitation around it. And I think that the thing that is important to remember about ADHD is that it's a neurological condition.
Mm-hmm.
So we can do psychological interventions and try to change the child's environment and adapt to make them the most successful, but it's not going to change that neurological condition. They are still going to have ADHD. Medication does change neurology. And so in some circumstances, when behavioral intervention hasn't worked, or if the child is really struggling, taking that step to change their neurology and maximizing the benefits of medication can be really helpful. But that again, that's something for the child to talk more to a prescriber, or the child and the parents to talk more to a prescriber about.
So, Lauren, within your practice, you have a medication management piece to it, right? Can you tell the folks about what that group does? Do they do you send them there if you see that they might need some medication may be helpful?
Yeah, so our prescriber is very willing to, just talk with people without necessarily making or giving a prescription. And for ADHD specifically, she requires that someone have a full assessment done prior to prescribing any medication. So if I believe that, okay, it's time, maybe we look into this option, then I would recommend that they schedule an intake with our prescriber and just kind of talk with her about, what are the options and what are the, pros and cons of taking this route.
Yeah.
I guess that was the question that I was asking before, and I may have framed it incorrectly, but it was like, if you're in therapy with a child and you suspect that there's, they haven't had an assessment. I know you said you would suggest that they get an assessment, but the medication part, it would be like, I think, maybe you need to talk to somebody about medication, or, medication is an option if you would like to talk to somebody about it. That's kind of what I meant. Not that you guys would prescribe the medication.
Yes. Yeah. So I think, well, like Meghan said, we're talking about a neurological condition. So we often see that medication paired with therapy and other supports is the most helpful. And at the same time, like Meghan said, people can be a little bit hesitant about that. Sure. So if that's the case, I think I'm open to trying behavioral and other therapeutic interventions first. But at the point that maybe we're not seeing the kind of progress that we would want, is when I would make that suggestion.
Yeah. We feel the same way. It was a challenge for us to make a decision, for me especially.
Well, it was for Tony. When we found out Anthony had ADHD,
we worked through it though.
I started researching it, and I knew that medication was one of the options. And so I said, we're going to go talk to the pediatrician, and he goes, well, I'm not putting him on medication. And I said, let's just wait and see what he has to say. So our pediatrician said, you don't have to medicate him. Mm-hmm. You can just do therapy or whatever. You don't have to do anything. But I'll tell you, when that child is 12 and 13 years old, they're going to start self-medicating, and then you're really going to have problems.
See, that was my Italian my Italian hard-headedness coming out of me, that my child didn't need medication, but it worked for Anthony.
It did.
It took a little time, but parents need to understand that it may take 1 or 2 trials of something until they find the right medication that'll help their child. Right?
Yeah, and I think just being educated on, the side effects and how you can mitigate some of those things, which the psychiatrist can help you identify, is beneficial. And there's ways to manage anything that would be scary.
Yeah.
Mm-hmm.
So we've got a roadmap here. So if the child's going for therapy, you identify that they might need an assessment, Meghan would step in and then do a full assessment the right way, involving the school, a pediatrician, the parents, other parties. It's almost like what we call a 360. You get everybody involved, understand what's going on with the child, and then from there you might identify any co-occurring conditions that may be involved here, and you may recommend some therapy and help with those co-occurring conditions. And then the parent and child work together, come and see a therapist and get the care they need. And it's parent coaching along, and then the medication discussion comes in, and all of that. So for families listening, that's the roadmap. That's what needs to happen. There's a process behind this, just like everything else. And we shouldn't feel bad about it.
No.
Your child is nothing wrong with your child. Your child is special the way they are. And so, giving parents some thoughts here. What would you say to parents listening in as they go through this process, and giving them some comfort and thoughts? What are some words of guidance you could give them as we get ready to close?
I really like the quote. It's from Tom Robbins, that equality is not treating different things similarly, it's treating different things differently. And kids who have ADHD do have a neurological condition that makes them different. And so expecting them to be able to function optimally in a world that is not set up for them neurologically is not going to be the best option for them. And so in looking for the best option for a kid, really understanding their mind and how it's working and what they need in order, again, to show up as their best selves is the best that we can do.
Yeah, that's great. Lauren, how about you? What words of advice would you give parents?
I would say you don't have to figure this out alone. There are resources and supports out there to help guide you and help your child be successful and live a fulfilling life.
Right.
Meghan, what age is the youngest child that you have assessed?
Yeah.
For ADHD,
yeah.
6.
Okay, so that's first grade. Mm-hmm. So you don't see it a lot for kindergarten.
No, kindergarten classrooms are much more willing to adapt to children's behavioral needs, and so you don't really see behavior problems surfacing until they're a little bit older. They're expected to function a little bit more autonomously, be more independent.
What are some of the positive things about ADHD that we can tell parents? Like, are they, they're kind, what are some of the characteristics that ADHD children generally have that are real pluses for them?
Children with ADHD generally, or people with ADHD in general, feel emotions bigger than other people and tend to be very empathetic. So, very tuned into other people and what's going on. So, they generally are kind, if somewhat annoying friends.
If they're not annoying their friends.
Right, right. So kindness, really being able to think outside of the box. You mentioned creativity, and you do see that a person's mind is, able to wander a little bit more than other people's. Um, if they have things that they're very interested in, they can be very, very successful in those things.
Yeah,
Sometimes,
so like entrepreneurs and thinking outside the box, that kind of stuff, and creative in arts and in music and in all kinds of things. There's a lot of artists that have ADHD that have been really, really successful. So, but they hyper focused on what they really, really love.
Great. So, hey, I think this was terrific.
I think so too.
I think we hopefully we answered a lot of questions. I think we have answered a lot of questions that our parents have.
Do you have anything that you're thinking about that maybe we didn't cover that you would like to talk about?
I think we hit the main points.
So, families that are listening, parents, if you feel that your child may have ADHD, you're getting signs that we've talked about or you've heard, please reach out. I mean, the point here is to reach out. Don't because at the same time, you don't want your child struggling, and not, feeling isolated because they can't deal or whatever it might be. We want to get them the help they need. That's the point. That's the main point here we want to make. So, and why don't you share your websites with the groups? Megan, why don't you share your website so that people know where to go, and we'll put it in our notes, in our captions too, but share your website with everybody so people know where to find you.
My website is differentpathmentalwellness.com.
All right, and Lauren?
And mine is chrysaliscenter-nc.com.
All right, and we will put those in the captions below so people can reach out. And again, for North Carolina. But at the same time, if you're in different states, please, there's a Megan and there's a Lauren out there in different states just willing to help and wanting to help. So please feel free to reach out and do some reference sources and before you pick the right one. So we like to close with a couple items. Casey, why don't you share our closing message for this?
So as we recognize Children's Awareness Month, let's remember that every child is a story still being written. When we lead with kindness, we help them write chapters filled with hope, courage, and connection. The little things we do today can shape a brighter tomorrow for them and for all of us.
So true. So, and then we like to finish each of our segments with our family motto, and we'll say first, today is the best day of your life, and tomorrow will be even better. So why don't you join us as we close this out?
Today is the best day of your life, and tomorrow will be even better.
So thank you both very much, Megan and Lauren. Best to you. Enjoy the rest of the summer, and thank you so much for your time, and we appreciate you. All the best.
Thank you so much.
Thank you.
Take care.
Thank you for spending time with us today.
If you liked today's episode, please like, subscribe, and share it with someone who could use the information. And remember, a little bit of kindness goes a long way, especially for those kids with ADHD. See you next time.